from Colorado. Okay, we're being recorded. Current Chair Maria Perez was not able to join us today and looks forward to speaking at a future meeting. Thank you so much, Dr. Lutzow.
Well, I appreciate the opportunity. This is great. I'm speaking to you from Colorado Springs, Colorado, and this is my first Zoom meeting holding a cell phone in front of me. So I hope this all works. It's kind of interesting what you can do. We have a new grandbaby, and baby Jane is the star of the show today, and we're just paying some attention to her today. We're heading back to Milwaukee tomorrow. The point that I think we want to talk about today is Milwaukee and the mental health community is about to do something really terrific. It's been in the planning for some time. The Mental Health Board itself, is part of a momentum that was created long before the Mental Health Board was even formed. And part of our responsibility, I've always felt, was to continue the momentum that the Mental Health Task Force was part of starting many years before the Mental Health Board was even formed. So I do think we fulfilled the promise of continuing that momentum in some important ways. And one of those ways was to make sure that as we privatized the inpatient facility service, we did that in a responsible way to bring the best qualified service to the city and the county. Certainly there were efforts along the way to find a local solution that couldn't happen, that didn't happen. We were always enamored by Universal Health Services and the breadth and depth of their capabilities. And thankfully they stepped forward, but not without a lot of research. We did have an internal task force evaluating their capabilities. As part of that task force, we actually sent out teams, several members, and Mary Neubauer was on those teams. And I think, Barbara, you might have also been, Barbara Beckert, on the team that conducted site visits out east and even in Florida to meet with leadership, Universal Health Service leadership at the local level, and in some cases actually meeting with patients of those facilities to get a sense as to how they conducted themselves, and coming back together with those individuals who gave reports on those visits. It was quite impressive. Universal Health Services is committed to a Joint Commission accreditation. I believe that's going to be coming soon here as part of Granite Hill. Many positive things are going to come as a result of this. One of them is additional funds are going to be available for community services. We don't yet know how much that is. We're going to have to fund a transition, which is maybe a little bit on the expensive side, transitioning from the current BHD facility to Granite Hill. We'll see how all that flows. We're lucky to have Jennifer in the position she's in because she understands both sides, the BHD facility side as well as now the Granite Hill side. So the transition is probably going to be smoother than it might otherwise be. The other benefit is Universal Health Services is extremely qualified, and Milwaukee County patients are going to be a small portion of the total patient volume in that facility. It looks like it's going to be 120 beds. If we occupy 30 or 40 beds, that will be a lot. And so our patients are going to be integrated with the normal average community patient that would be a part of that facility. So it's not going to be as segregated as it might be at the current facility. The other part of the process that I think, looking back, was extremely important, and that was keeping the state involved in the decision. And Rose Clement especially was part of the committee, the task force itself, as well as subsequent discussions in selecting universal health services. Keeping the state involved in the decision-making process, I believe, has paid dividends, both with respect to how Granite Hill is going to be developed, and also the new psych center and how that is being developed. Having the state as a partner, intimately involved, at the ground level in the thinking, the planning, the decision-making was extremely important to help understand the tax burden, making sure the rates and fee schedules were appropriate, and transition of funds from facility-based services to community-based services and how that might be facilitated. All of that was important, and we did make a lot of really effective steps and right steps to get to where we are now. I'm excited that Jennifer, who is going to be following me here in a moment, is where she is in that position as CEO. I think some of the staff who she knows at the current BHD facility are going to be in a better position to transfer over, and it's going to be a least disruptive event than it might otherwise have been. So we're very pleased. I think the community deserves to be pleased. And I would guess, and I expect, that Milwaukee and Granite Hill are going to be visited by several other principals around the country to see how this happened and what the result was of these decades of planning. And I have frequently heard from Michael, Michael reading a report that occurred 20 years ago that described where Milwaukee County should be in terms of privatizing the service. And it looks like we're finally there. Some of the thoughts and plans that were created and written down 20 years ago are finally materializing. It's kind of an amazing thing to see that we're finally where we want to be with inpatient services. So, kudos to everyone involved. Kudos to the Mental Health Task Force. And we still have work to do. We need to remain strong advocates. Not everything is going to go smoothly, but if we work together, it's all going to turn out well. So thank you.
Thank you, Tom.
I'm looking in the chat for any questions, and I don't see any.
Any questions for Tom before we move on? Okay. Now we will have a Granite Hills Hospital update. Jennifer Bergenson is the new behavioral hospital. Jennifer Bergenson is the CEO of Granite Hills, the new behavioral health hospital expected to open in late September. It will provide care for patients referred from the Milwaukee County Behavioral Health Division as the mental health complex closes. We are pleased to give a warm welcome to our next speaker, Jennifer Bergenson, CEO of Granite Hills Hospital. Many of us have had the opportunity to work with Jennifer during her decades at the Milwaukee County, including most recently as a Chief Operating Officer at BHD. We are very fortunate to have such a respected, experienced, and dedicated professional in this key leadership role. Jennifer, we hope that you will be a regular at the Mental Health Task Force, and we look forward to working with you in your new role at this important time for our community. We share a long list of questions, and thank you for doing what you can to address them in our limited time together. We recognize that this is a continuing dialogue. Folks can also feel free to ask questions in the chat, and we'll share those with Jennifer. Jennifer, welcome to the Milwaukee Mental Health Task Force in your new role as CEO at Granite Hills Hospital.
Thank you so much, Mary, for the warm welcome. And it's so nice to see so many familiar faces. And I too am just so pleased and excited as to where we are, having started at the county in 1999, and to see how it's transitioned and transformed, and what a wonderful opportunity we have in order to make a difference in the lives of others in the community. So thank you so much for having me here. I'm committed to participating in this committee going forward, and I'm really committed to collaborating with each and every one of you as we continuously improve services and provide a great option for citizens here in our state, our region, and our community here. So what I'm going to do to just piggyback a little bit on what Dr. Lutzow had said, to talk about some of the breadth and depth of resources regarding Granite Hills and UHS. I have a few slides that I'd like to go to if I'm going to share my screen. Following those slides, I'm gonna give a little brief overview about Universal Health Services, move into some updates as it relates to Granite Hills, and what I've been doing in this past month since beginning employment at UHS Granite Hills, which began June 7th. So I've been there just about a little bit over a month. And then I was the recipient of all of the questions that we had. And it looks like there's a total of about 33. And I did my best to answer most of those questions, if not all of them, and at least in some capacity. And at the end of the slideshow, I will go through those questions, provide some responses, recognizing that some may be incomplete and more detail be needed, but with our committed partnership going forward, I'll be able to share updates along the way. So right now I'm gonna go off video here and pull up slides. Give me a second, please, and thank you. Can everyone see the slides?
Jennifer, we aren't seeing the slides at this time, I don't think.
Okay.
No slides.
Okay, how about now?
Yes.
Yep. Okay. All right. Thank you for that. Okay. So I'm just going to give a brief overview regarding Universal Health Services. Many of you may already have this information, and probably several of you do not. So in regards to some of the breadth and depth of the resources, let me advance here. Universal Health Services was founded over 40 years ago. We're close to 90,000 employees, and now with me on there, maybe it's 90,001. They've brought a combination of strategic acquisitions. They've expanded, they've engaged, as Dr. Lutzow said, in joint venture and partnerships, and they have a diversified set of assets, and they are committed to quality care. There are a lot of questions that I received that talked about what's the philosophy of care, or what's the mission as it relates to what we're going to do at Granite Hills. So I'm just going to give a little overview of that. The portfolio in regards to what is provided by Universal Health Services, I'm going to hone in here at for this behavioral health component. They're a leading behavioral health provider. There's 334 inpatient and 15 outpatient facilities in 38 states. DC, Puerto Rico, and the UK. They have a proven track record of acquiring facilities and also bringing new facilities and new services into different markets. So it's pretty vast and big, and I'll tell you a little bit more why I'm bringing this up. We serve over 700,000 patients. We have 340 inpatient beds. We have other facilities supporting Patriot support programs, and you can see the annual revenue and investment on the right-hand side of the screen. There's over 400 facilities, and now you can see in the little state of Wisconsin, we'll be able to make a color in there. You can see just the expansion and the services that are throughout our nation and internationally as well. Again, serving approximately 90,000 employees. We have physicians, nurses, veterans, again, patients served, licensed beds, and patient days. The mission, and it's regarding to several questions that I received, is truly to provide superior quality healthcare. Brenda had mentioned, you know, it's one thing to have a beautiful facility, both structurally and physically, but what kind of care and what kind of quality are we going to be providing to individuals who come to us who need services and care? So our mission is to ensure that patients, when they come to us, that they recommend our care and services to family and friends, that physicians who work for us and physicians who are other providers in the community prefer our setting for their patients, that purchasers select us for their clients, that employees and the teams that are working at Granite Hills, they're proud to be there and they provide excellent care. And of course, investors are happy and pleased with returns. Our principles in which we aspire to is to provide superior quality patient care. I take extreme responsibility and understanding what I need to do in order to be in this position to provide services for patients, that this is a privilege. The opportunity that I personally have and what our team has is just extraordinary. And we have the responsibility to do this right. And we're going to work really hard to do this right. We want to value each member of our team and their good work. We want people to provide care and services with compassion, that we empower employees to be competent in the work they're doing and they're committed to the delivery of services. We want to hold ourselves to high ethical behavior, and we really underscore the fact that caring for our patients truly is a sacred trust. And we are devoted to serving our local community. We want to play a special role in the community. We know that there's a gap and there's a need for services, and we really cherish that responsibility. And, you know, I want you to hold me accountable to that. Again, we want to deliver our healthcare with passion, dignity, respect. We want to provide quality healthcare. We want to do it in a financially appropriate and be good stewards of that. And we want our setting to be an employer of choice in all markets, and that people want to come to work here and as well as to get care and services here. This is just a quick slide regarding some of the quality distinctions UHS has received, including industry accolades from Fortune, Fox, and Forbes. And then something that's near and dear to me for those who know me and all of my work in the quality committee at the mental health board and Mary's quality committee of the board, has to do with measuring quality outcomes, and patient satisfaction is a key indicator. 90% of UHS hospitals were satisfied with their treatment. 91% felt better at discharge than when they were admitted. I'm really committed to ensuring that we have measurable data in order to identify whether we're providing a good quality of service and what that looks like, listening to our patients and identifying opportunities for improving. We also, of course, will be reporting on CMS measures. We also will be working and acquiring Joint Commission accreditation. And we're going to make sure that we hold ourselves accountable to performance targets. These are some of the places where we have different behavioral health centers. I actually was on one of the tours with several people here at Hampton Behavioral Health Care Center some years ago. And now let me talk about where we are today and moving into Granite Hills. So UHS has understood that there's a significant rise in demand for services. So as Dr. Letzow had pointed out, with joint ventureships and partnerships, new care delivery models, you can see on this map all of the places in which there have been some new opportunities for healthcare, including, you can see now in the state of Wisconsin, where our partnership with Mike Lappin and his team at Milwaukee County Behavioral Health Division. And beginning in September of 2021, and I'll talk a little bit more about that later in the presentation, our goal will be to open and provide services for patients here at Granite Hills. And if anybody's had an opportunity to drive by, it's really extraordinary. And I look forward to inviting all members here of committee to come to tour and to visit this setting. So everybody knows how I love pictures. This is our new setting, one of our new websites in which we talk about bringing online a 120-bed facility. We're going to have three particular units for adults, one unit for geriatric and older individuals, and then one unit for children and adolescent units. You can go to our website. There is a press release, and we've also provided some additional information for individuals to find out more about Granite Hills. Now, I could probably sit and talk through this map probably for a couple hours, and I know people would be very excited to go through it. So I just wanted to give people a heads up before our tour in the next month and a half. And this is a little bit of a roadmap or a map of the particular hospital. And I just wanted to I'm going to do a real brief overview. Again, it's not blown up to this specificity that I'm sure people would want to see, but I just wanted to highlight a couple things. This is kind of our main entrance and lobby and one of our admission areas, followed here by our administration and C-suite and our own developed courtroom in our facility, which is new for this particular hospital. There's an entire area for activity therapy, including a almost 3/4 basketball hoop area. Try to get the Bucks to come in there to practice, but they're very busy preparing for the next win, I hope. Next here is an outpatient entrance where it's actually divided between adult and children. So when we get to outpatient services, we have a really safe entrance. It's an exciting area. To the right of that, we have our food services, where we will be actually cooking and having food prepared on site. Food is such a satisfaction piece for all of us at any time, and especially when people are trying to heal and feel better. We have, again, at the back end here will be some of our support services. And then if you look just from the diagram, there's an area for adolescents, there's an area for geriatric or older individuals, and there's also an expansion and for adult units 1, 2, 3 here, with an opportunity for expansion and need on this back end. What I wanted to point out, there's an adult entrance here for an adult sally port area in the event that people need to come in from another setting through here. We also have an admission setting where people can come up and walk into the facility. And then we also have an area that's behind this panel, an entrance specific for children. You can't see on this particular graph, but there is external courtyards, there's internal courtyards, there's activity therapy in groups. And I'm really excited to show you when you come for a tour, just how we created a healing environment in each of the patient rooms. So this is a high level map, if you will. I just wanted to give people a brief layout or understanding of our layout before they come and tour. Probably a lot of questions about it, but I just wanted to make sure to share that. We have a Granite Hills website, an area where people can apply for careers and view all openings. I'll talk a little bit about that later. And then I was just informed yesterday from our extraordinary media team that we now have a Facebook page, and we're encouraged to get social with us. And there's a Facebook link here, and I will share this information with committee chairs in order for this to be passed on to the committee. Sorry. So current activities. So I've been there a month. So I thought, well, what is it that I can share that people would find meaningful and helpful in order to give people an update. So these are some of the things that myself and my team have been working, and I'll talk a little bit more about that. For those who don't know, we're located at 1706 South 68th Street. We're currently working with our construction team on completion of the building, including inside and outside. We're engaged in a lot of various inspections, if you can imagine. We're preparing for occupancy, and our goal is to create this therapeutic healing environment of care. A huge part of what I've been doing since I've been coming on board has been working with team recruitment, interviewing and hiring, and also developing some onboarding, education, and employee development. There are a lot, if you can imagine, of what it takes in order to open a hospital. There's many licensure submittals, joint commission application, and various applications that need to go in order to open a new hospital. We're also securing required contracts and submitting related documentation in order to provide all the necessary clinical services. And we're developing our media, career website, and communication. Some of the upcoming activities that will be in this next month is I am working with Mr. Lapham on a recruitment fair. I'll be coming to the July 22nd town hall meeting to talk to the Behavioral Health Division staff, followed by an in-person meeting at the Behavioral Health Division to share materials and information on related openings. We will be posting additional staff positions and opportunities mid-month. So be looking for that on our website. We'll be spending a lot of time onboarding new staff. In order to provide excellent care, we need to onboard people and to do that well and ensure that our staff are empowered and have the tools necessary to provide good care. I'm working on planning an open house and related tours, which could be either at the end of August or a week or two into September. It all depends. We will have a lot of coordinating to do. I will be certain to inform this committee as we land on that date. There are a lot of operational activities and workflow development that needs to occur. There were questions that people had wanting to know, how does someone access services and what is that workflow? And I will defer some of those questions to later when we get our clinical team on board in order to walk through those steps. There is a lot of work to do on contracts, the necessary transportation, lab services, and all related clinical services that support a hospital, establishing rates, working with insurance companies. There's a lot of these components that we're working on prior to opening. Basically, all the requirements needed to open a hospital. We have a project management team that is just unbelievable with dates and times and deadlines, and we all meet together on a weekly basis to report in updates. For example, I give administrative updates and where we are with hospital licensure and to that nature. And one of the things that, the reason why I brought talking about some of the breadth and depth of resources, that people ask me, so you're in your new job, what is it that's different? What is it that you've noticed right away? One of the things that I've noticed is with all of the hospitals that are online and the structure of UHS, there are regional and clinical and senior leaders within the company that you can reach out to identify next steps, things to work on, lessons learned, just an unbelievable depth of knowledge and resources. And that to me has been something that's been really extraordinary. And it's with those resources, I am working with a current CEO in Michigan, who is working with me as she will be opening a facility probably a month or so after our facility. So we're working in tandem to get things to, up and going together. And it's been a great experience as it relates to onboarding. So with all of that, that brief overview, a little bit more about Granite Hills, me sharing with you what I've been working on this past month. And a lot of that is just getting to know people and finding the resources and knowledge that's out there in order to do this well. I received these questions from Barbara, and if at all possible, I'll take a break here and ask if there's any questions. And if not, I will move forward to the questions that Barbara submitted to me and some of my responses and answers to those, whatever the will of the committee is.
Sorry to interrupt. Could you please stop sharing?
Yes.
Thank you very much.
You're welcome. Any questions of what I've mentioned to date, having been there for a little bit over a month?
Jennifer, there are a few questions in the chat. Would you like one of us to read those to you? Would that be helpful?
Let me see here. I'm going to scroll up here. All right. Yes, if you want to read any of the questions, I see more comments than questions. Oh, is there like yoga, arts, and craft room? Yes, there's an activity room. I can't tell you everything that is inside of it or what will be planned for it, but there will be a huge push for active treatment and programming and ensuring that individuals who are coming in for care and treatment are provided these activities. So I'll be able to provide more specificity as I bring on my clinical team. Does the job fair include peer positions, and are you requiring certification for peers? I have a response for that in my question when I get to that, because I'm really excited about, I need this committee's help. So hold me to that. I have a question that, a response to that a little bit later. Yeah, my goal, if Michael have me, I hope to be in the VHD conference room in order to provide some recruitment information when I do come on board. And we have to have plans for keeping school for children. One of the goals and one of my tasks is to reach out to the West Dallas School District to ensure the requirements indicate that we either provide teaching services through UHS or we can work with the district. So that is one of our tasks to do, to ensure that children are getting the necessary services. Did I miss any?
I think there was a question about having interpretation on site positions that was in the chat.
Yeah, we can, those are on some of the questions, I think, Barbara, so I can go through there. Why don't we do that? Oh, hi, Angie, thank you. I'm excited, got to talk to you. I was just reading her chat. There's definitely an interest. I've had several counties reach out to me personally, inquiring about services at Granite Hills in the region. I have a couple meetings on the books already. Okay. All right, so here are some of the questions, and perhaps let me know. I could read through them, provide some responses, and wait for questions at the end. Would that be preferable in order for me to get through all of them, or what is the will of the committee?
That would be preferable.
Okay, so what I'm going to do is I'm going to read the questions and provide some responses. Again, remember, there will be more detail as I move further along in implementation of some of these things. So the first had to do, are there any documents you can share to explain the new hospital, the floor plan, capacity, and other basic info? So you did see a brief copy just now of our floor plan. Basic information will be provided, and for our open house and different tours. Our projected capacity will be targeted for 120 beds. However, we're going to start with an initial phased-in approach. We have to have our staff prepared and ready to serve our clients, and we need to do that thoughtfully and to do that in a way that's safely and to ensure quality. So we will be phasing in, beginning with a unit. The next question was, can you walk through the expected flow and experience for new patients, voluntary with insurance, voluntary who are uninsured, involuntary with private, involuntary who are uninsured, admissions for kids? And there's a lot of detail here. And to me, I think that I could talk through that in a meeting later, because it really involves a lot of operational flow and defining that activity. And I'd like to get my clinical staff in those conversations. But what I can say is all manners in which people are going to be admitted are going to be, all individuals will be treated respectfully and with dignity, no matter how they come into our care and services. There won't be difference there, of course. Number 3 is, will patients be directly admitted at Granite Hills, or they need to go to PCS or the new emergency mental health center once it's open? I anticipate multiple front doors or access to our services. People can come to Granite Hills. People can come and be referred from PCS. They may come and be referred from the new mental health center and other partners and other community needs and other providers. So I anticipate many avenues to come to get services here at Granite Hills. Number 4 was, how will people be transported from the emergency mental health center to Granite Hill? And my response is there's going to be various transportation options. Some may need to be secure, some may need to be ambulance, and other contracts with transportation may be determined. So we're going to have to carefully vet the appropriate transportation depending on the situation, because we want to ensure safety and manage risk. And not one fits all. Number 5 is for uninsured people. If they are admitted at a private hospital, will they be transferred to Granite Hill? Granite Hills will be an option for our community. So potential transfer agreements or other options with other providers will be explored. Number 6, are a certain number of beds designated for county funded patients? If the hospital is filled, will county funded patients have to go to Winnebago? You know, it's my job to work diligently with county administration to ensure that those services that are needed for individuals have access to Granite Hills. And so it's going to be an ongoing partnership to ensure that we are creating a situation where individuals will come and get service and move on to community-based care. So there's a contract, there's a lot of details to that contract, and we have to work really hard with Mike and team in order to fulfill those obligations. And we're going to work together in order to meet those needs. Number 7, as compared to VHD mental health conflicts, what will be different about the experience from the patient perspective? I think that's a great question. I can tell you one thing that'll be different is the physical environment of care will certainly be different. We just didn't have the facility, the physical environment being new. We were able to do a lot of state-of-the-art build in order to support people's wellness and safety. So I can tell you that's going to be a big change for our patients. In regards to other things that would be different from the patient experience, well, we're going to hold ourselves to established metrics to measure quality and how we can continually improve. And having the experience that we've had in measuring patient experience, we can continue to do that. And I'm certain I'll be able to come back to the committee here and share with you what is different and what are some ways in which we can improve. Number 8 is, what can we tell clients or family members about services provided by Granite Hills? Any resources available that we can share? So our team is currently working on some materials to provide and promote services available at Granite Hills, and resources will be shared when available. So we're currently putting some of this information together as we speak. When I have more, I'll be able to share more handouts with you. Number 9 is, how is the hiring process going? What positions are filled and what's ahead? And can you tell us about your leadership team and how will you coordinate with BHD on hiring? So my leadership team right now is myself as CEO. I have a director of plant operations and a human resource director. And we were hired we were hired on board, and we have been interviewing and bringing more individuals on board. There are some folks who are in a state of being offered a position right now. but we have a CFO in place, a director of business development, a director of healthcare information management, and an executive assistant, which will be starting in the next one on Monday and a couple in the following week. And we also put we also have something, and we also have an offer with an IT specialist currently. We have a lot of positions to fill. We have a lot of leadership positions to fill, and we have a lot of staff positions to fill, but we're going to start with a phased approach and make sure that we will gradually build going forward. Number 10, if a patient develops a serious medical problem, what medical support will be available on site and what will be the protocol for addressing patients with medical needs that cannot be handled on site? So all appropriate medical assessment care in connection to the appropriate level of care will be facilitated by medical staff. And when our medical staff gets on board, we will be reviewing our policies and procedures to ensure that patients and who may have a change of condition or need specific medical services that we can't provide are actually transferred to the appropriate level of care. What will be the role of certified peer specialists at Granite Hills? So this is what I wanted to bring up, and I'm looking for, I saw Shirley on here. I'm interested in, from this committee, 1 or 2 individuals who would like to meet with me as it relates to, I see you waving, as it relates to peer specialists. Because I would like to sit down with you as experts to identify how we can incorporate peer specialist services at Granite Hills and what that looks like. And I'd like to sit down with 1 or 2 of you in order to identify that and plan that out going forward.
Absolutely.
Okay. Shirley, anyone else? Okay.
Right. I can give you some recommendations.
That's what we want to do, is I want to tap into your expertise.
Sure.
And so we can figure out, I have a couple ideas, but I want to validate that with you and tap your brain as it relates to peer services at Granite Hills. So
okay,
thank you.
We'll be in touch. Thank
awesome. You. Thank you, Shirley. Okay. Number 12, I'm sorry. Okay. Number 12, what is the treatment philosophy? Will the hospital make use of OT, music therapy, and other therapies? What will be in place to create a healing, recovery-oriented environment? Well, I did share some of our information regarding our mission and vision. And our goal, of course, is to have this a therapeutic environment, a really focus on something that I'm going to set that expectation and accountability is programming and treatment 7 days a week, and that includes weekends. Obviously, that'll be centered with patient-centered care and patients participating in their treatment. And then we're going to have a safe, structured environment in order to provide services. Specifically regarding activity therapy and who's going to be doing the therapy and what kind of modalities we have yet to further define. And I'll be able to tell you more of that in a subsequent meeting. Number 13, what will be done to minimize use of physical and chemical restraints and encourage voluntary treatment? Will the hospital have restraint rooms? Seclusion restraint is only a last resort to ensure safety. Usage of that will be monitored in quality goals and dashboards. It will be a measure that I will be held accountable to. Attention to patient safety and prevention and patient participation will be required. My plan is to empower and train our staff in order to perform these functions and to do it well. And in order to do that, we're going to provide the necessary education and re-education to identify and de-escalate potential events. And one of the key things that will be very important will be upon a review of these events, in the event that it is needed, there's going to be a focus on quality improvement and analysis and lessons learned as to how we could avoid and prevent that from happening altogether. So that will be a huge quality indicator for our team. Number 14, will patients have their own rooms or share rooms? Room placement will be dependent on patient assessment and need. Rooms set when I walk through our facility are set for double occupancy at this time. Certainly if we needed somebody to be in their own room based on a particular clinical need, we would do so. There's been an extra effort to provide a healing setting in these rooms, both attention to the beds, the placement, storage, the items within the bathroom and the facility, And there's also some different murals in there that you'll be able to see, really nice additions to create a really healing, calm environment in the rooms. And I'm excited to bring you in for a tour to take a look. Again, there's a gymnasium, there's courtyards and different activity rooms, and I'll be able to show that to you upon tour. 15, what are the plans for family visiting? Visiting hours will need to be established. Certainly, we're going to ensure that patient treatment activity times are prioritized so that we ensure that people are getting all the correct treatment that they need on a daily basis. And I want to stress that family involvement, significant supports are encouraged to participate in their loved one's care based on the patient's direction. We'll do everything we can in order to work with that family unit to assist the patient in their recovery. Number 16, when will the hospital be fully staffed and functioning? And what is the timeline for transitioning patients from the behavioral health division? Again, this is going to be a phased approach. We're going to start with one 24-bed unit and a smaller number of staff to complement the number of patients we had. We're going to target a September patient occupancy, most likely the end of September. And we're going to work out those operational details with Mike Lappin at the Behavioral Health Division regarding patients and how we would successfully transition and or move services from Behavioral Health Division to Granite Hills. We have yet to work out that detail. Number 17 is what will be the transition with PCS and when is PCS closing? And I am going to defer to Mr. Lappin regarding when PCS is closing. I'm sure it's dependent upon the build and the acceptance of the new mental health center that's coming online, which I believe he's going to talk about in an upcoming agenda item at this meeting. Number 18, how soon do you anticipate the hospital will become Medicaid certified? Well, let me tell you, I'm working on all required licensures and certification and more paperwork than I've ever knew existed. And so I'll be able to tell you when we get those approvals, but my pile of things is long, and but we're getting there. We're taking care of it. Number 19, can you explain how the court process will work for people who are detained? I'm going to defer this question. I'm going to refer to our court system and our current processes. What I can say is Universal Health Services has constructed a courtroom on site, and we'll be working to ensure that we're following all the appropriate legal processes. But how the court process will work, I think needs more, would need to be talked about in more detail in a different forum. Number 20 is how will Granite Hills staff coordinate with the jail and justice system for people who are in jail or from jail? And I'm really excited. We will hold ourselves accountable to connect with diversion staff as to continue collaboration and to assist individuals. I have some great partners at the county who can help me with those connections. Number 21 is what approaches will you use to inform patients of their rights, ensure that they understand them and have access to advocacy assistance if desired, and will advocates be able to meet with patients and clients on the unit? All regulatory requirements, my response is all regulatory requirements for patient rights will be established, including posters, acknowledgement of rights, brochures, info regarding appeals. And Barbara, I'm hoping that you can provide me either a handout or posters regarding disability rights as well, because I want to make sure we get all the appropriate inpatient posters on the units, access for appealing, and also how to contact disability rights. So I'm hoping you can help me with that.
Absolutely.
I put on their poster request, Barbara. Okay. And we're going to work, this is near and dear to my heart. I oversaw client rights and the patient right experience. And so we're going to ensure that people's rights, they have access. A grievance committee will be established. We'll ensure that people have the opportunity to submit concerns and complaints, and we will work hard and probably also collaborate with our peer specialists on some of those, ensuring that people get what they need. Number 22, how will the hospital address the needs to have services that are linguistically and culturally appropriate for non-English speakers, including deaf individuals, knowing that the needs for interpreters will vary and it's hard to predict? Is there a way to have a shared pool for interpreters for Spanish and other languages as well as ASL? So thank you so much. We're looking for contracting for such services. there are some services within UHS, but I'll also be looking at some additional local services. I'm interested, I know that this came up at the, I believe the Emergency Mental Health Center discussion or community forum. So I'm looking for this committee to connect me with the deaf and hard of hearing community and others in order to get me up to date on all the current resources that are available for our patients. So if any of you wants to give me a name here today or offline to do that, I want to make sure that we have the correct complement and menu to ensure that patients have a right to, you know, receive their services in a manner in which is understood. So I'll look to committee to get more recommendation. Number 23, Milwaukee is Wisconsin's most diverse county, and how will the hospital ensure that staff are culturally competent and respectful, and that services are welcoming and inclusive of Milwaukee's diverse communities? Well, to me, it starts with leadership. It starts with listening to the voice of those served. It starts with hiring individuals, a diverse team, and it also includes employee education and development, including excellent customer service training. It'll be my expectation of my team and the staff that will be welcoming, respectful behavior and support of our organizational mission and principles and values. And we're going to have, our plan is to have accountable supervision and to look at how our systems support the best patient outcomes. And if something is not working to where it needs to be, that we have a system to continuously improve. And what I need to do is to rely on our community partnerships. All of you find people here and others in order to help us improve and to hold us accountable. And our policy and structure needs to reflect those served. So I'm looking for experts as we collaborate together in opening this facility and providing services, ongoing collaboration in these efforts. Number 24, how will you address the specialized needs of people who have a developmental intellectual disability in addition to their mental health needs? This would also include individuals with other aging needs as well. And my plan and my goal will continue to ensure a knowledgeable workforce with connection to community resources based on needs. I see later in the agenda, you have some of my other former Milwaukee County partners coming on board to share some of their resources and connections. So it'll be very important that continue ensuring that when we are assessing individuals, that we connect them to the right services. Describe the staff roles will be based at the hospital to connect patients, community services, and what were their roles to provide effective and safe discharge planning and connecting people. How will we partner with community CARS and ADRC and family care? Again, my background is social work. I'm going to ensure our director of clinical services and our clinical team and discharge planners have the latest education. I'll be bringing resources, hopefully community resources in to educate us to make sure that we have the latest information in order to provide people the opportunities that they so deserve. And I'll be looking to continue our partnerships in order to increase our knowledge base as it relates to that. What will be done to address the housing needs? Again, similar collaboration, connection to housing resources, and supportive options. That will be something that will continue to ensure that people have safe and affordable housing in order to maintain wellness in the community. What is the approach? Number 27, what is the approach for discharge planning and how will follow-up happen, such as CARS, medications, mobile teams, to minimize the likelihood of future crises? Again, as above, continued partnership with and connection to our team with all the wonderful services that the county and other private providers have, including crisis and various services to prevent readmissions. The goal will be to ensure that our discharge planners have the tools in order to be successful, in order to connect individuals to the correct level of care and services. And so they can have a choice and option as to what they believe they need in order for them to drive their care and treatment. Number 28 is, what is the plan to assist with public benefits, especially for people who arrive at the hospital are not insured and need to help with enrollment? Again, I'm looking and exploring contractual options for such services and or possibly looking and seeing if there be an individual on our team who would be specialized in such services. I still have to work through the details there, but certainly I understand the import of ensuring people are connected in enrolled in benefits. 29, and just got a couple more left here. 29, what is the plan for community engagement in the planning process and after the hospital opens? Will there be a community advisory council? I like that. We want to encourage our community to be invited to the open house. And I want to create a forum to address community concerns and part of that will be to be determined what that'll look like, what kind of forum that will be. So that's something I'd like to talk about a little bit later as we roll out and implement an opening of a hospital, and then how we can engage members of the community to share concerns and or to provide updates. You have my commitment as CEO to participate here in this committee and other various committee meetings in order to further connect and collaborate with others. Number 30, will there be an open house and opportunity for tours? Yes. Either late August or mid-September, depending exactly on how we can plan that. I should know within a few weeks what that'll be. And 31, does the hospital plan to participate in the mental health task force and other community meetings? Yes, I'm here and present and will continue to do so going forward. 32, what's the plan and timeline for pursuing Joint Commission accreditation? We've already submitted our application. Most likely there would be some targeted survey prior to end of year. And number 33, has UHS and other states had success with any strategies to address the workforce shortage, including strategies to recruit staff from diverse communities? It's an excellent, excellent question. And it's so timely. This morning, I received an email to attend a quote monthly recruitment strategy forum that's being held across various hospitals in UHS. So that's just another example of how when there are issues or needs as it relates to strategies and resources, that I get these forums that I'm invited to in order to connect and to learn from others. So I'm still learning. I'm excited to see that there are these other options and resources. Just a little disclaimer, I know I provided a lot of information today. It's as best as what I know it today within this month. Things will most likely be revised and or updated as I get more information, more people on board, more information, more knowledge about some of the resources that are at my disposal at Universal Health Services. But what you can count on from me, basically my summary is my commitment to this community, my commitment to do this well, my commitment to collaborate with each and every one of you in order to provide a positive experience for individuals who come to our care and service. And also my commitment to improve. No one's perfect, but we have the tools in order to analyze and look at systems that support better service and better care. And so I'm committed in order to ensure that we prioritize those lessons learned. And I'm just really excited to be part of this community in this capacity with all you wonderful partners and providers as we move forward together. So that is my update for July. Having been there a month, those are some of the information that I have at this time, and certainly I'll take any questions and any questions at this time.
Hey, I believe there's some questions in the chat.
Okay, I'm looking down on the right here.
Just a couple of questions that I pulled out. Are you looking at a family advocate within the hospital? How are you addressing accessibility for people with disabilities and LGBTQ? And also some suggestions about offering training for supporting people who are deaf, hard of hearing, and Denise has offered to be a resource for that.
Excellent, excellent. That's Denise Johnson, right? I see on here, yep.
You got it.
Thank you. I think too, first of all, any assistance and additional education and resources and bringing the community experts in order to help our team be competent and ensure that we're up to date is something that I certainly will embrace. There are accessibility requirements that we needed to meet for the physical location, of course, but there's also accessibility in which how is it that we assess individuals, how is it that we're meeting individuals with diverse needs, and how is it that we are organizing ourselves in order to meet all the needs of the community. And to me, it's ongoing education and training and ensuring that we have our own insight into what we bring to the table when we're engaging with individuals, but an openness to work with other partners in the community in order for us to have additional education and knowledge and how best to work with individuals who may be different than us. And so my expectation is that we assess individuals fairly and consistently, and that we connect individuals appropriately. And when we find ourselves or our skill set not where it needs to be, that we involve providers, individuals who can provide training for us in order to get us to where we need to be. So I don't know how else to answer that question other than we're open to improvement and education and training, ensuring that we're empowering our staff to do a good job to help people.
Well, thank you, Jennifer.
Yes.
Excellent.
I think I made through my timeline, Mary. I think it was 4:05, so I'm 4 minutes over.
Yeah, you did an excellent job. Thank you very much. And you answered a lot of questions.
Right. There's more to happen, more detail to be fleshed out, but I just wanted to give you a current state where things are at. And please, if people have questions or if something that I discussed today or it didn't resonate or it didn't meet the expectation or what was thought, that needed to be responded to, feel free to reach out to me and we can have a dialogue and more conversation.
Most definitely do that. Thank you very much, Jennifer.
Yeah. Thank you all for your time.
Okay.
Appreciate you. Thank you.
Christine.
Thank you very much, Jennifer. As she so aptly stated, there's a partnership with the county, and I can't see on the grid, but hopefully Michael Lappin is here. Just a quick shout out to Mike Lappin. We asked him quite a few times to speak to the Milwaukee Mental Health Task Force, and he always says yes, and he always is so friendly and informative. So thank you again for giving us your perspective on this transition. Hopefully you're here.
He's here. Where did he go? There he is.
Bueller.
Hi there. Hi, everybody. So I was asked to talk about transitions and fill in some tough shoes here following up after Jen and Tom Lutzow. I can be pretty brief. There's not a ton of new information that I can provide that hasn't already been covered. The Mental Health Emergency Center project moves forward. The Mental Health Board at its last meeting, which was, I believe, last week or the week before, approved the joint venture agreement. And then the joint venture board had its first official meeting where some of the documents and the sort of articles of incorporation and the sorts of things needed to set up a joint venture nonprofit organization were handled. The construction of the new Mental Health Emergency Center facility is underway. They haven't officially broken ground yet, but they have put up the fences. There was a little bit of a holdup with the city of Milwaukee on some permits, which have now been granted. It was like the permits for the foundations and I believe one other permit. Everything is in place, and I believe the sort of soft groundbreaking will be July 19th. There is not an event or anything planned, but we will eventually have some sort of celebration of that new facility and the collaboration about it. We continue to seek support from a number of venues for funding both the Mental Health Emergency Center and the Crisis Continuum. There are significant funds available both from the city, the county, and the state as part of the recovery efforts around COVID-19, and certainly the anticipated spike in need in our community that we know is happening already and we expect to continue for some time because of COVID-19 is going to put a strain on resources. So we're hoping to expand our community-based services and build all kinds of services around the new Mental Health Emergency Center and around the new Granite Hills facilities. So our community has a solid continuum of care that is accessible and accountable to all of the people that need us. We probably won't have much of an update on the Mental Health Emergency Center for a month or two. The position was posted on Monday for the new administrator. I believe it's a vice president position at Aurora. That person will be the leader of that facility. Thank you again to Barbara Beckert, who sent that out to this list. It's going to take the right person. That's a position that's going to really require lots of knowledge and experience, and especially local knowledge and experience, because obviously, as you all know, Wisconsin and Milwaukee County have some pretty unique mental health rules that need to be followed. And the new Mental Health Emergency Center will serve in the role of a receiving facility under Chapter 51, along with all those other things we hope it does, like being a warmer and better front door for customers to access that continuum of behavioral health services in our community. As far as the transition from BHD to Granite Hills, we're excited that Jen's on board there, although we miss her, no one more than me, to be totally honest and transparent. But her experience and knowledge running the BHD hospital for so many years, and the connection she has with all of you and with us, I think it just couldn't have gone better from a transition standpoint to have her take that role. We will have her as a guest at our next town hall, which is a week from Thursday. And we will have the first of what will probably be many on-site job fairs. The best case scenario for BHD employees and for everybody is that we can come up with some sort of a logical transition, thoughtful transition, where the workforce that is keeping these services going here can transfer over to Granite Hills. There just aren't enough staff to go around. And it should be no secret that staffing all around is a real challenge for medical services, for our hospital, especially us right now, because as you know, we're closing and everybody knows that. So it's very difficult to fill positions. We've got some very mission aligned folks that have been here a long time that will be very valuable to future state. And we want to make sure they see the path so that we don't lose them. We have lost some key staff, I'm not going to lie. Jen was a big loss. We've lost a couple other key people recently because of all the opportunity. But again, we're going to work really closely with Jen and her team to try to keep all those folks to make it work. We are also recruiting on a number of fronts. We have a number of crisis expansions at hand. Right this minute, we're recruiting for a number of crisis clinicians and cart workers, but also we have 15 new crisis positions, crisis mobile positions, and peer positions in the budget for 2022. That's just around the corner. So recruitment in general is going to be a challenge, and recruitment for inpatient obviously is a specialized service that those physicians, nurses, peers, and techs are in very short supply. As far as the transfer agreements and all those sorts of things, we haven't even had the chance to really go there yet. We do have an agreement, which you've all seen in the contract with UHS. Basically, UHS, it must basically serve the people that we serve. And the agreement pretty clearly states that BHD is the priority customer, that we have a guarantee that if there's a limited number of beds that we get first priority for those services, and that essentially UHS will serve everybody we send there. We recognize that there's always cases that could potentially exceed the capabilities of the facility for any number of reasons. And we certainly understand that even today, BHD's occasionally has to have people transferred to the state hospital. It is extremely rare, and we would anticipate that to continue to be a rare event at Granite Hills. We are very much looking forward to more capacity in our community, especially with the single room occupancy required of us by COVID. We've been operating well below what has been a long-standing sort of limit, minimum number of inpatient beds in our community. And I'm very concerned that as the need is increasing and we're seeing a lot more business, that the community just doesn't have the capacity. So we all have our fingers crossed that that first day, patient day happens soon, and that Granite Hills is providing that resource to the community as soon as possible. September is just around the corner, but it also seems like forever away, in that we really need to have those beds at our disposal for those people that do need an inpatient stay, that we have an efficient and humane way to get them into that care, that it's a low barrier service, and that the discharge planning includes a really strong connection to our services operated through BHD and the services delivered by many of those that are on the task force, because really the inpatient care is always just a tiny piece of the puzzle, and that quality discharge planning, good connections to community and preventative care are really the key to keeping people out of crisis and helping to move people forward on the path to recovery and sustainable positive outcomes for them in their lives. So that's really all I have. I'm absolutely happy to answer questions, specific questions if people have them. I just don't have much other to offer that hasn't been already delivered by Jen and Dr. Lutza.
Mike, this is Barbara. I know you may not have an update on this, but just continuing to wonder where things might be standing in terms of some of the transitions, you know, from the emergency center to either to Granite Hills or other inpatient facilities, as well as the engagement with community services, and if there are any quick updates you might have on that front.
I don't have any really new information. We have to figure out transportation and how people are going to be transported from the mental health emergency center. I've talked to Jen. There's probably a significant population of folks that we can simply just either share a vehicle or have some sort of ride. I mean, it doesn't necessarily have to be a secure transport. It doesn't have to be, it certainly doesn't have to be a police escort. So we believe for the average person, we'll be able to just set up an agreement around transfers. We've had some discussions about using the future sheriff's cart team for those cases that require a more secure transport. We do have folks that are really struggling in that moment of transfer. One of the real challenges is that under the current system, people can be transferred and admitted from PCS to an inpatient service almost seamlessly. It's literally down the hall. But the EMTALA standards require us to stabilize an individual before they can be transferred from facility to facility. So one of the challenges, or one of the side effects of the new mental health emergency center is people may require a more lengthy stabilization stay before they can be transferred. So we're going to try to figure that out. The good news there is the milieu will be much better and much more customer friendly with natural lighting and a little more space. It's also safer space. It's easier to manage. And it does include some semi-private areas, I guess I would call it, where people can sort of have some space by themselves. There's also much improved space for families and children in a separate space, separate area. So those are some of the current shortcomings of PCS, that we just don't have the space. It's a really tight, tiny milieu. But those are challenges that must be overcome. The challenge has been, we've been working so hard to get here that now we move in over the next year to this phase of operationally solving challenges. We also know we're not going to be able to plan ahead on everything. We're going to have to, through experience, just use our continuous quality improvement framework and just continue to make the system better. Again, it's helpful to know that we have great partners with Jen and her team at Granite Hills. And, over time, I think we're going to get to be much more efficient. We toured a facility in Pennsylvania that UHS operated that took just about all of the referrals from the city of Philadelphia and the city's crisis service that's operated in Philly. I want to say the day we were there, and Jen or Mary or Brenda can help me here, but I want to say they had 18 discharges on a Monday, and 16 of those discharges went back to the city of Philadelphia. And they were able to figure it out, and they had gotten it down to where admissions took 5 minutes. So basically people were conveyed to that crisis or to that hospital. And because they had already been medically cleared and they already had been stabilized at a crisis facility, it was basically like a transfer of custody right to the units. There's no reason to believe we can't get to a similar model here. And, and that was maybe a 30 or 40 mile drive in that market. For us, it's just going to be a 5-minute drive over to 68th and Mitchell. So I think we have the framework in place to do it. It's just getting the agreements in place. I've actually reached out to the state to work on a transport model. I raised this with Kenya Bright and a few others, and she thought it was a decent idea. We wondered about having essentially hiring a driver, and then having a peer support specialist be sort of the individual who goes along and makes that transport a little more tolerable for the person being transported, kind of explains what's happening and make it part of that transition process. That would be something we could do. It should be billable under the crisis service. I think it's a really good use of a peer, because I think that it's such a stressful moment, that transition from a crisis service to the hospital. So that could be a way to serve some folks. I think the bottom line is there's not going to be a single path. We're going to come up with a person-centered approach for every person, and we're going to do our best to make sure that it's done in the most least restrictive, but most patient-friendly and patient-centered way possible. So.
Great idea.
Any other thoughts or questions?
I have a question, if you don't mind, young man.
No, happy to try.
My name is Reggie. I don't know how well you can hear me or not.
I can hear you perfectly.
Because I'm hearing impaired, so I don't. Cool. I heard the LA say something about prisoners and stuff in jails. I got lost by how she was explaining that. How's that going to work? Are you saying that prisoners who are in prison now, who are really, too far gone, they don't fit in that situation, can they come to your place and get better care than what they do in prison? Or am I misunderstanding the young lady?
Yeah, my sense is that there are concerns about people who end up in the jail or the prison because they haven't been adequately treated. And some folks actually come to the hospital from jail because they have a mental health crisis. Those individuals would be treated just like they are today here at BHD at Granite Hills. But this really wouldn't be a service that replaces or works very closely with the prison system. Probably more likely serving people who need mental health services, who perhaps have some criminal justice entanglements, but it certainly doesn't replace an incarceration or a prison unit or a jail unit.
All right, thank you, young man, for your time. I appreciate it.
Sure. Any other questions for me?
Guess
all right, then. Well, thanks for the invite. Happy to come back as soon as we have more information. And then really, you all know how to get a hold of me. I'm happy to, if something comes up between now and then, just please reach out.
Thank you.
We'd like to thank both you, Jennifer, and look forward to having you as a regular speaker at our meetings. And Mike, thanks for joining us today and providing the county's perspective on the major transition. And now our next speakers are going to talk about the proposed Aging and Disability Resource Center merger. The 2021 Milwaukee County budget had a surprise in it, and that is a plan to merge the Milwaukee County Disability Resource Center and the Aging Resource Center. And at that time, the Mental Health Task Force shared some concerns with county leadership, and we were told that there would be a robust process for stakeholder input. And we want to welcome Rachel Kenny-Frank and Karen Bachman, the managers of the Aging Resource Center and the Disability Resource Center, who will speak to us about the transition and opportunities for community input. Rachel and Karen, welcome to the meeting.
Thank you, Mary. Can everyone hear me okay?
Yes.
Yes.
Perfect.
Thanks, Mary.
You're welcome.
Mary, is it okay if I share my screen, the PowerPoint that was distributed to the group?
Yes, it is.
Okay, thank you. Is it appearing for you?
Yes, it's up. Rachel.
Wonderful, wonderful. Good afternoon, everyone. My name is Rachel Kenny-Frank. I'm the manager of the Aging Resource Center, as Mary stated. Thank you for having us today. Karen Bachman is with us as well. She's the manager of the Disability Resource Center. So as Mary highlighted, in the 2021 budget, the county executive included plans to have the Aging Resource Center and the Disability Resource Center merged. This joining your group today and talking with you about this as part of our stakeholder input. We do have, it's kind of a developing process that's going on, and we are planning some listening sessions as well in August. That is hot off the press though, so I don't have a lot of details yet for that. Just as a little bit of background, the ADRC services provided to Milwaukee County residents include a variety of things, just bullet pointed information and assistance, which is typically done over the phone or for people who are walking into our physical location. We do options counseling, which is the process that also includes determining eligibility for Wisconsin's long-term care Medicaid programs that you're probably familiar with, Family Care, IRS, PACE, and Partnership. We offer the enrollment and disenrollment counseling from those programs. We have dementia care specialists, benefit specialists, and youth transition services. In addition to other things, those are our main responsibilities and services that we're providing to Milwaukee County residents. Common resources that we help people connect with, particularly through that information and assistance touch point, and also through options counseling. Transportation is always an issue that people struggle with that we can help people navigate and connect to resources. Home care, personal care, caregiver support and respite. Affordable housing is also a hot topic, assisted living. We connect people with mental health services, and of course, the publicly funded long-term care programs that I mentioned are also very common. It's a very large percentage of the work that the Aging and the Disability Resource Centers do. So getting to the background of the issue at hand, a little bit of information if you aren't already aware, Milwaukee County is the only county in Wisconsin that has separate resource centers depending on what age a person is at. So our resource centers, as they're set up right now, the Disability Resource Center serves people who are age like 17 and a half, so 18 to 59, and the Aging Resource Center serves people who are age 60 and older. The Aging Resource Center and the Disability Resource Center both provide the services based on the same contract with the state. We operate by the same statutes and administrative code with the state of Wisconsin as well. Milwaukee County, as I'm sure you've heard, we're working toward a no wrong door approach to services, which is, it's about breaking down silos of work. How can we work more seamlessly together, improving the health outcomes of people that we serve. And that's across the board for DHHS and Milwaukee County, but behavioral health, housing, energy assistance, resource centers, how can we all work together to serve people coming through just one door and not sending them to multiple different entry points in the system to meet all of their needs. So, and that Milwaukee County has a mission of becoming the healthiest county in Wisconsin by achieving racial equity, and No Wrong Door is part of that. The solution is part of what we feel will help us achieve that mission. As Mary stated, the 2021 budget included the provision to combine the resource centers as part of 2022. So currently, we're gathering input from stakeholders as we design the service provision. How are we going to do the information and assistance, the options counseling, the benefits counseling, things like that, as a merged Aging and Disability Resource Center without with maintaining customer experience, customer satisfaction, meeting people's needs. So we want to hear from you regarding what you need our services to look like. We're approaching multiple different groups, Karin and I and Marietta Luster and John Janowski. We're all kind of meeting with regularly meeting boards, commissions, groups to ask 3 questions. in addition to the listening sessions that will happen in August. One of the questions that we'd like to hear people's thoughts on are, how can a combined Aging and Disability Resource Center make accessing services and supports easier for people? If people have thoughts at this time, you're welcome to share them right now. At the end of this, we will also give you our email addresses and phone numbers for you to contact Karin or myself with your thoughts. We also are interested in hearing, your thoughts on what can we do to improve our service delivery through the integration and improvement process. We're always, this isn't the end of the storybook, right? We're always looking for ways that we can improve, ways that we can be more efficient, ways that we can increase our customer experience with our services. So although this is a very large planning year and really important to start this right, we're always going to be looking at how we can do better and how we can improve even after 2022, of course. Excuse me. And we also are interested, if you are part of or know of other groups that regularly meet, that we should be reaching out to for input. I wish I could have put together the list of all the groups that we currently have. We have been given quite a few. Barbara shared quite a few suggestions with us already as well, of groups that we can approach and ask for time, at their regularly scheduled meetings. But if you have other ideas or are part of groups who would be interested in sharing their thoughts, we could attend those, or you can also share our contact information as well. And that is the end of what I wanted to say. Karin and I are here for questions or comments right now, or this is our contact information too.
May I have a comment, Christina?
Yeah, most definitely, Maria. Go on.
Okay. Hi, Rachel and Karen. I'm calling as a user. My daughter, she has Down syndrome, so we have been long-term care, and we are very active. We just have Down Syndrome Association. Let me tell you, we don't need merger. What we need is more offices. And what we need you is to actually move around the city, because if you live in Good Hope of Silver Spring and you don't have a car, to get to Velitan 12 is hard. And you are so understaffed that when you get there, it's mayhem. And it's unfair because a lot of the users, a lot of the people are either having, are women with small children, and it's a man room, no way of distract the children, even when it's a very long wait. There's no privacy in the restrooms. So if it's a breastfeeding mother or change the diaper, there's no. So what you need is to actually move around the city instead of putting it. And as time of responses, I love my counselor, but I try to call for a peer about housing. I don't know. I think we're still waiting for a response after 2 years. That's not fair to you guys. But no, it took a long time. It took so much time to get an answer. And it's because you are so understaffed. I mean, I've been there and people just give up their lunch time. Kudos to you. But Windows 6, they give up their lunch time to take you because that's how I understand. So what I think it worries me a lot, the merger, because, and also the needs are very different, and I don't know, I'm just thinking of the building, and it's a nightmare. You have a wheelchair or you need a walker, and then food stamps is just a stand in the corner. I don't know. It's not a pleasant experience, to tell the truth. And if you are going to merge the two groups, at least aging people or this, disabilities, we have that little smaller room, maybe longer weights, but at least you have a chair. So in general, if you haven't been there, it's very hard and it's heartbroken. And I don't know. I mean, I'm very, and maybe more than agencies, reach out to the people, because it's scary. It's really scary. It's complicated. It's too much paperwork. It's too much waiting from one to another. There are too many offices. I don't know. I'm just telling you how it is. I probably will work fine. I know you're very smart people. As I say, you do the best you can. But just thinking about having to go to the offices, and everybody's trying their best, but I don't think you will have happy people. Sorry about that, but
no, I appreciate your input, and I'm jotting down your ideas. Maria, just for clarification, when you're talking about the physical location at 12th and Valete, and some of the concerns, absolutely, the building is inaccessible, and we are working with facilities to plan a remodel in the coming years, long overdue. Are you talking about income maintenance, who's on the first and second floor, or the resource centers on the third floor? I feel like maybe a little bit of everything.
A little bit of everything, and you just pointed, right? Just think about me. I'm a mom. I don't speak English, right? I've been just told that I need, and you have all this, the building, it's one stop. Very good, that's what parents need, right? One stop so I can do everything. But the problem is that there's not a very comprehensive, lovely entrance. You wait a long line and you come. Mom, Spanish and English are spoken here. Awesome. Everything is trilingual. But that is just to send you to the waiting room. And then in the waiting room, they call you to a window. And when you're in the window, you have to say, well, this is what I want to do. This is what I need to do. And tell you, oh, well, you need to go to second floor, or you need to go to third floor. And then after that, you have to negotiate the building, and the building is not comprehensive, right? And I cannot imagine trying to negotiate with a wheelchair, moving around to go to food stamps. And the second thing is the waiting area is not friendly in terms that maybe you have some computers. Also, something about someone to tell you, because one of the major issues is people wait a long time, go to the window, and they don't have the papers. So somehow of having checklists and a way to help people after they wait for so long. So in general, it's the access to the services. Once you get rolling, I assume it's fine, but people that is coming with questions and have issues, or people with not very good literacy, it's very, 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 very hard. And then when you have elderly people, you're talking with the population without cars. To begin with, you don't have parking spots, so that that started. But so it's not that easy to come and go in buses to the stuff. So we're thinking, yeah, merger maybe, but maybe what you need is to spread throughout the city. You have almost one on the south side, but still that's not enough. So I don't know if I'm making, but I'm telling you, after years and years of having to go and talk and meetings, excuse me, sorry, excuse me, oops. It's very hard, not to mention the outside is not very attractive. So I think sometimes I feel like there's very little respect for people that needs the services, the way the building looks with so poor maintenance. And that's your first contact. When you go there, I say nothing to do with the staff. I've been there and say, no, I can wait, oh, lunchtime. Say, oh no, someone, I will take my lunch. The supervisor, I won't take lunch. I will keep on moving people. A very good staff, but something there shows like there's not enough respect, particularly if you are in a lower economical status, you know, not to have an attractive building, not to have enough things for people to do. And mergers always sounds like less resources, less money. I don't know. I may be just misjudging. Sorry.
It's okay. I appreciate your input. Thank you.
Bye. Well, no, bye. I'm still here. I'm just going to mute myself.
I could just say something. That person made an excellent suggestion, and I think that's certainly something to consider for the future. We are a large city. There are people located all over the city, and you know, to aim to try to have some ADRC staff, you know, located in hubs, you know, in other locations besides the COG Center is a very good suggestion. So thank you for that.
Can you take down the share screen, please?
Yes, ma'am.
Thank you.
I'll work on it. Oh, Mary, how do I take down the share screen?
You're asking the wrong person.
It's the green icon at the bottom of your screen.
Oh, see it. Thank you so much. Zoom is new to me.
Hopefully we'll forget about Zoom at some point.
Thank you so much for your time today.
Thank you.
Just one last comment before you go. Thank you both so much for coming and the opportunities for input. I just wanted to mention that one of the really great programs that the county and Disability Resource Center has is the Disability Benefit Specialist Program. And I just find that there's very little awareness of that program. I bet if you pull this through, you know, and the mental health community really needs that. So anything that this change could do to expand the program, because it's very small. You know, other counties have as many disability benefits specialists as we have, and we're the largest and most diverse county. And to do more outreach, I think would be really terrific. It's a great program, and we need more of it and more awareness.
Thank you, Barb.
Great suggestions. Thank you.
Maritza was on until about 10 minutes ago, and then she had to jump off. But I can tell you her staff are all going to be out doing outreach between now and the end of the year. Everybody's going to be going out. So absolutely.
Great.
Yeah.
Great to hear that.
Yeah. And I guess I'll make a comment. I am not in favor of merging the ADRC and the DRC. You know, it's two totally different populations with two totally different sets of needs. And we have a lot of people with mental health issues that fall outside of the Aging Resource Center, and those needs get lost and fall by the wayside. And, you know, there's just been some collaboration going on with the behavioral health division, excuse me. And you know, the progress that's been made, I believe, is going to be totally lost if the ADRC if the ARC and the DRC are merged. And I think it's going to be devastating. I mean, I just, you know, I look at the ADRC governing board, and there's nobody young on the ADRC governing board. It's everybody's over 60 some years old. I was the last young person on there, and I now fit in the old category. And the fact that there's not anybody young on the board is just devastating. And there's a lot of young people with disabilities, and there's nobody representing mental health on there. You know, I come in and do some reports, and that's it. And my schedule is pretty jammed. So if there's anybody out in the audience that lives with a mental illness, there are openings on the Aging and Disability Resource Governing Board for folks to be on the Aging Disability Resource Governing Board. So if you're out there and you're interested, please email me or give me a call and I can give you some information.
Thank you, Mary.
We are recruiting.
Yes. Well, thank you for being here today. Greatly appreciate you being here and reaching out to us and heeding to Barbara's call. And we have your 3 questions and we will answer those.
Thank you.
You're welcome. Thank you, Rachel. Thank you, Karen.
Thank you.
Thank you. Moving on to the next topic. Last week, Governor Evers signed into law the biennial budget. So here we have Mary Neubauer and Barbara Becker to talk about the results of that budget. And I guess we're going to Barbara first to talk about the budget.
Yes, thanks everyone. This is Barbara again. I know we're short on time, but I do have an overview that I wanted to share very quickly, and then I can send it out in email. So I'm going to share my screen and we can just walk through some of the highlights of the budget that was signed into law by Governor Evers last week, with a focus on those areas that were priorities for the mental health task force and the advocacy community. So I will share my screen here. All right, so I hope you're seeing a document that has 3 columns with the budget ask, the governor's budget proposal, and the budget approved by the legislature. Everyone seeing that okay?
Yes.
Yes, good. Thank you, Mary. So I'll just run through some of those very quickly. It was very much of a mixed bag in terms of mental health services, with a lot of missed opportunities, but there were some positive things that moved forward. The budget included an increase in reimbursement for outpatient mental health and for child adolescent day service. And some increase did move forward in the budget approved by the legislature, not at the same level as what the governor asked for. Same thing with crisis response. The governor had included $12.6 million for regional crisis centers and $5 million for regional crisis stabilization facilities. So a total of 10 million GPR was included for all of those services. So quite a bit less than we had hoped for. In terms of county crisis phone lines, that was not included in the budget, and nor was the funding for peer run warm lines, something that we had hoped to see move forward. So that was disappointing. Some specific funding for Milwaukee in the budget, both for mobile crisis and for our Milwaukee trauma response team expansion. Those were not funded. Collaboration with law enforcement funding to expand the CIT program or to sustain it, $750K was included, but other funding for an emergency response collaboration grant was not. Psychosocial rehab services, there was a proposal to expand those to include private insurance companies. That was not included. Child psychiatry consultation program, that's a program that we've supported that Dr. John Lehrman has played a leadership role with from the medical college. So some funding was included to expand that, not at the level that the governor had included, but glad to see some expansion. There was a proposal for a forensic assertive community treatment team that did not move forward in the budget. I know Mike had been enthusiastic about that. A number of people in our coalition worked very hard on a proposal to address inequitable access to behavioral health services for people who are deaf, hard of hearing, or deaf blind. And we're really gratified to see the governor included 1.9 million in his budget, but the legislature did not approve any funding for that. So that was very disappointing. Medicaid room and board reimbursement for residential substance use disorder treatment facilities. This is so needed in our state, and there was a good chunk of funding included in the budget, but it was not approved by the legislature. So very disappointing. So those are the highlights from the mental health budget. I'll just mention a couple of other things and then I'll turn it over to Mary, and I'll send this out to you so you'll have more detail. As we all know, Wisconsin remains one of the few states that has not moved forward with Medicaid expansion, and we're leaving so much money on the table. So, as well as not getting access to care for so many people. So that is very disappointing. There was some funding to address access to dental care by increasing Medicaid reimbursement rates. We really have a crisis with access to dental care. So glad to see that. There was a very good news about increase in personal care reimbursement. That's an area where the legislature actually went beyond what the governor asked for and did a larger increase, very much needed. So kudos to them for moving that forward. There were a number of things in there to provide support for babies and toddlers exposed to lead. And of course, that's an issue in a lot of the state, but it certainly is an issue in Milwaukee County and can result in lifelong disability. Unfortunately, there was no expansion of funding for that purpose. So very much a missed opportunity and a significant human cost. In terms of justice reform, just a few things to mention. That's a priority for our coalition. There was no funding to expand the OARS program, Opening Avenues to Reentry Success, which supports people who have a mental illness who are returning from prison to the community. It's a program that has had a lot of good outcomes, so very disappointed that was not expanded. Our coalition and some of the folks who are here today, I know have worked to have expanded funding for TAD, and there was an expansion, but it was quite modest. 2.5 million GPR, quite a bit less than advocates asked for and less than what the governor provided. And returning 17-year-olds to the juvenile justice system, that did not move forward in this budget. Wisconsin's now one of only 3 states in the country that includes folks, that includes young people as adults when they're age 17. Finally, the last thing that I want to mention, and I'll send this full summary out, relates to transit. And it was very upsetting in the budget to see that Milwaukee and Madison were singled out for a 50% cut in transit operating aids. So we had hoped that the governor would be able to veto that, but his veto authority is more restrictive than it used to be, and there was not any way under current law that they were able to veto that. So we're hoping that there'll be a way to address that with ARPA fundings, but it's very alarming because transit is so important to jobs, to access to independence, healthcare, so many things for people in our community, many people with mental illness and many other people, and for caregivers to get to work. And this will be the base budget next time. So really discouraging to see Milwaukee targeted in this way. So those are that's the overview of the budget. And I also included a little bit about some of the vetoes that relate to mental health. So I'll turn it over to Mary now. If anyone has any questions, feel free to put them in the chat and I can respond there. And I'll also send this summary out to our email list. Take it away, Mary.
Okay. On July 8th, the Mental Health Board unanimously approved the mental health budget. And I was trying to pull up the budget and I can't pull up the budget. Is Mike still on? I don't see Mike. I was gonna let us know what the dollar amount was and I'm not recalling. What I do know is, unfortunately, our budget was cut, the tax levy. We were at the floor on the tax levy at, it was cut $80,000 to $53 million. And that was the lowest that the tax levy can be for the budget by legislative standards. and that was disappointing. But all in all, there were some expenditures in the budget. There were some expansions in CCS and in some other areas. So it really turned out to be a positive budget. There were no amendments in this year's budget. And so it ended up to be a positive situation. We still have an opening on the mental health board that's being addressed. It's been open for about 15 months now. I'm drawing that from memory. It may even be different than that. It's a position for a substance use provider that's been open since Mike, I'm drawing a lapse on Mike's last name.
Mike Davis.
Yes, thank you. When Mike Davis resigned from the board. And so we're in the midst of trying to get the county executive's office liaison to get going and filling that position. And so that's pretty much where things are at. I believe we've got an executive committee meeting coming up the 12th of August, and our next mental health board meeting is August 26th. And so that's pretty much what I have to report. The June 8th meeting was simply the budget meeting, and the whole agenda was simply budget approval. So nothing else significant to report from that meeting. So I just want to mention again to save the date for August 10th for the Mental Health Task Force annual county budget briefing, including remarks from County Executive David Crawley, and that will be with all of the departments from the county departments, excuse me. And September 14th is Celebrating Recovery, Ending Stigma and Embracing Possibilities, the 2021 Karen Avery Forum. Remember to get nominations in for the Karen Avery Award and for the Marie C. Perry Rising Leader Award. And that we have the 2 openings for a member, for a provider and a member at large, or advocate and a member at large on the steering committee. And that the membership information will be coming out for the Mental Health Task Force. And I'd again like to thank Jennifer for all of her comments and preparation for today, Mike, and Tom Lutzow for stepping in, and Karen and Rachel, and co-chair Christine and Barbara. So thank you, everybody. Thank you for attending the meeting today and asking your questions and your contributions. And we'll see you on August 10th. Have a great day.
Thank you.